Welcome to this week's edition of the Health Policy Institute's update on the impact of COVID-19 on the dental care sector. I'm Marko Vujicic. I head up the Health Policy Institute. Chelsea Fosse, my colleague, will be joining us in just a second, where we're going to give you the latest insights from the data. Before that, just want to make sure for our industry folks joining us, a couple of weeks ago, we launched a new analysis on a different topic, but related, where we look in depth at how COVID-19 is reshaping dentists' purchasing behavior when it comes to buying equipment and supplies. Lots of great insights. We monitor how dentists want to interact with sales teams, what their intentions are for various types of equipment and supplies over the coming months. Really important for manufacturers and distributors in the dental care space to have a look at this report. It's very economically priced, $400, lots of great insights and very detailed data as well that we present in the appendices. So have a look at ada.org/HPI. As usual today, we will cover the latest tracking data. This will be for the week of November 30th. Our questions of the week this round focus on PPE pricing and the use of distributors, some really insightful, interesting data. We also focus on Medicaid and provider behavior in terms of disenrolling from the program, as well as intentions to disenroll in the coming months. And lastly, we'll also focus on consumer sentiment as usual. Details on methods as usual are available on the website. We won't go through this. We've been tracking dentists in private practice every 2 weeks. We've been tracking dentists working in public health settings every month. So I will turn this over now to Chelsea to walk through the latest data. And remember, all this is available at ada.org/HPI. So go ahead, Chelsea.
Thanks, Marko. We'll begin here with practice operating status. We've been asking, what is the current status of your dental practice? The green line represents dentists in private practice, and the orange dots indicate dentists working in public health settings. As of the week of November 30th, 99% of dental practices in the US were open. About 1/3, that 32% of practices reported business as usual in terms of patient volume, compared to about 21% in public health settings. Next, we have patient volume. We've been asking, how does this week compare to what is typical in your practice in terms of total patient volume? If you look on the far right and see the blue 76%, patient volume was estimated at 76% of pre-COVID levels in dental practices. This represents a slight decline since the August-September timeframe, but has been stable in recent waves of polling. Again, the orange dot here indicates patient volume in public health settings, which has consistently trailed that of private practices, and was at 66% of pre-COVID levels as of the week of November 30th. This is again showing patient volume. There's some variation in patient volume by geography, DSO affiliation, practice size, and specialty. Higher patient volumes were reported by dentists practicing in rural and suburban areas versus urban areas, dentists in group practices, and by oral surgeons, endodontists, and orthodontists. We've been testing the relationship between patient volume and COVID outbreaks or increase in COVID cases at the state level. Overall, we haven't been finding much of a relationship here at all. Next, we'll look at staffing. When asked, is your dental practice paying staff this week? Approximately 92% of dentists are fully paying their staff. An additional 6 to 7% say they're at least partially paying their staff as of the week of November 30th. As we've discussed in the past, one of the biggest hiring challenges reported by dentists has been recruiting hygienists to fill out their teams. We've been working hand in hand with the American Dental Hygiene Association to better understand these challenges. Overall, though, staffing has been stable. And this is supported by data from the Bureau of Labor Statistics. If you look at that green line, that represents employment in dental offices as of the end of November, shown in the far right. We are back up to 98.5% employment compared to January levels. Not much change in recent months, though. Here's our standard core question asked every wave regarding PPE supply. How many days worth of the following PPE does your practice have at this time? On the left, we have the different types of PPE, and moving from left to right in these bars, the red indicates 0-day supply, and then we move forward to green on the right, indicating more than 2 weeks supply. Overall, not much change compared to prior waves. Gowns and N95s remain the biggest issue. But now we will get to some more granular data on PPE. Some of our questions of the week were focused on PPE pricing and distribution. So here are those. We've asked specifically of owner dentists, how much have prices changed since the onset of the COVID-19 pandemic for each of the following items? There's a lot to take in here. On the left, you have each category of PPE. Then as you move down each bar from the darker shade of teal to the lighter shades, you see the price change. The price gets more drastic as you move to those lighter, price change gets more drastic as you move to those lighter shades. The darkest shade on the left indicates no change in price. The lightest shade of teal represents a 5 times increase in price of that PPE item. The gray portion represents dentists who aren't sure how the price has changed for these items. For N95s and face shields, items most dental offices didn't routinely purchase before the pandemic, it makes sense that comparison data aren't available. The rest of those are likely dentists who weren't acutely aware of the exact changes in price, though have felt the overall increase in operating costs as discussed in prior waves of polling. So what's our overall takeaway? Prices have gone up substantially. On average, across all categories of PPE, nearly 1/3 of dentists report that prices have at least tripled since the onset of the pandemic. Surgical masks and gloves have seen the largest price increases. The supply chain is pretty stable. The stockpile, by and large, isn't declining, but pricing is and remains an issue. Specific to gloves, we asked how difficult has it been to find the correct size and material of glove. Going from 1, not at all difficult on the left, to 5, extremely difficult on the right, we see that most, or about 2/3 of dentists, find it moderately or very difficult to find their preferred gloves as of the week of November 30th. We also asked how many distributors dentists are using now and were using before the onset of the pandemic, specifically for PPE. On the left is the before pie, and on the right is the after, or since the onset of the pandemic pie. Blue indicates 1 PPE distributor, orange is 2, gray 3, yellow 4 or more. Prior to the pandemic, half of dentists, in the blue on the left, relied on a single PPE distributor. Now on the right, it's much more spread out. Nearly 3/4 of dentists are using at least 2 different distributors. With the increased prices of PPE, dentists are now relying on a greater variety of distributors. Here are the distributors dentists were using before, up top, and now shown down below. This was a check all that apply, which is how we calculated the numbers on the prior slide. Across the board, these bars grow for each specific distributor from the before to now graphs, meaning that there's more price shopping. More dentists are relying on diversification in the supply chain, relying on more distributors, as seen on the last slide. But which distributors had the greatest increase in dentist use? Amazon and the other category. Some of the others include Darby, Safeco, TDSC, and Burkhart. Now we have a few questions of the week pertaining to Medicaid disenrollment. About a quarter of the dentists in our panel were Medicaid providers prior to the onset of the pandemic. We asked, has your practice disenrolled from Medicaid since the onset of the pandemic to these providers? About 8% have disenrolled. For those who have not disenrolled, we asked, is your practice considering disenrolling in the coming months? About 15% are considering. An additional 14%, shown in the gray on the right, are not sure. We also were wondering how the number of Medicaid patients these practices can accommodate may have changed since the onset of the pandemic. In green, you see dentists who say they can now accommodate more patients who are covered by Medicaid than before the pandemic. And on the far right in red, you see that roughly 20% of Medicaid providers have had to decrease the number of patients covered by Medicaid they can accommodate in their practices. We also asked of our Medicaid providers, is your practice currently accepting new Medicaid patients? The majority, indicated in green, are indeed accepting new Medicaid patients. There's some variation by DSO affiliation, practice size, geography, and specialty, as shown here. We're going to shift gears now and look at some consumer polling that we've been working on with Engageus, a leading research firm. They've been administering a survey to a nationally representative set of households since the onset of the pandemic, and we've collaborated with their team to understand consumer sentiment toward dental visits. This pie likely looks familiar to many of you, but there's a bit of a change here. With Engageus, we've been asking those who are typically dentally active or those who had a dental visit in 2019, what's your current point of view about visiting a dentist's office? Nearly a third in forest green up top have already been back to the dentist. Over half in teal are ready to go. That yellow sliver contains our assurance seekers, those who need a little extra confidence that it's safe to return. And the red slice, those who are waiting for a breakthrough, such as the impending vaccines that are now en route to states. We've seen a slight decline in this red and yellow, but there's still about 15 to 16% of the population that aren't quite ready to return to the dentist. Going back to our patient volume data, we reached that max of about 80% pre-pandemic levels of patient volume over the summer months, but have seen some slight declines since then. Given these data, the recent surge, we don't anticipate that practices will grow their patient volumes much in the coming months. Engageus has been tracking consumer sentiment toward a wide variety of what were once considered everyday or at least not uncommon activities over time, such as going to the store, going to a doctor visit, a dental visit, going to an open house, staying at a hotel, attending conferences. The forest green line tracks those who have already been back to or are ready to head back to the dentist from June through November. Overall, a steady increase since June, and the dental industry positioned at the top of this chart has fared very well, relatively speaking, in consumer confidence with safety of going back to the dentist. Further increases will be dependent on those major medical breakthroughs, again, like the vaccine that should be headed in all of our directions very soon. So to summarize our data from the week of November 30th, 1/3 of dental practices were open and business as usual. Patient volume was estimated at 76% of pre-COVID levels. Recovery has been slower in public health settings, where patient volume is estimated at about 66% of pre-COVID levels. Prices for PPE have gone up substantially since the onset of the pandemic. Nearly 1/3 of dentists are reporting that prices have tripled or more. Dentists are therefore relying on a greater variety of PPE distributors and more turning to Amazon and other smaller distributors compared to before the pandemic. COVID-19 has caused 8% of Medicaid providers to disenroll from their state's program. An additional 15% are considering disenrolling. The majority of Medicaid providers are accepting new patients covered by Medicaid, but roughly 20% of providers have had to decrease the number of Medicaid patients they can accommodate in their practices. Vaccine availability remains an important part of bringing the remaining patient base back into the dental office. On behalf of Marko and the entire team at the ADA Health Policy Institute, thanks so much for tuning in to this wave of polling data. We appreciate you being here. Look forward to seeing you again. Take care.